My name is Michael Cornett, or Cornett Michael. I work for the Northeast Regional Board of Dental Examiners, which runs the exams that dentists and dental hygienists have to pass in order to be licensed, which is why I say that we're the people your dentist is afraid of. I've actually almost been attacked by dentists and dental students who are like, why are those exams so hard? But that's how it is. I've been working there for about 10 years, mostly in registrations. Our jurisdiction runs from D.C., Maryland, and West Virginia, all the way up the East Coast to Maine, as far west as Michigan and Wisconsin, and we have a few standalone states like Oregon and Nevada. We also have arrangements with states like Arizona, Mississippi, Florida, and Hawaii, where we run exams, even though they're not technically members of the organization. But I have absorbed much information about dentistry in my time working there. I have access to a lot of very knowledgeable people. So I will say I am not a dental professional other than just working for a dental organization. And information is the results of my own research. I am not speaking as an official representative of my organization. That's the disclaimer. So a question friends often ask me is, why is dentistry still so medieval? It's hardly all that medieval these days. It used to be that if a tooth ached, they yanked it. And sometimes you could get boozed up beforehand, sometimes not. Today we have anesthetics of all sorts. We have fillings, implantology, all that. The big thing about modern internal medicine is it's about helping your body heal itself for whatever infection or disease you might have caught. Teeth do not heal. There's a song that says teeth are the only bones that show. And they are really basically the only part of your skeletal structure that sticks out naturally from your body with that nice little watertight seal called your gums. So maintaining that is kind of important, and if they get screwed up, they don't fix themselves. So that's why we have to be a little brutal, going in and working on them. Unfortunately, dental care is fraught with all sorts of myths and misconceptions. A lot of people fear going to the dentist. I hate it. I have been known to put it off as much as humanly possible, even though I work with dentists. They're wonderful people for the most part. So I'm not going to diss people, but, when you got a problem, you got to go get it fixed. One of the best ways to overcome your fear is to be informed and empowered, to know what you're getting into, to know what sort of things to avoid. I'm not exactly qualified on how to give you pointers on what to look for in your dentist, but I can point out some of the myths and the quackery that go around. So something that you may come across in your quest for quality dental care. And one thing we see a lot of these days, hear a lot of in advertising, is tooth whitening. All around, we are given messages that you have to have white teeth. The dental aisle of the pharmacy and the drugstore and the supermarket are full of all these products that promise to help whiten your teeth. It's permeated our culture to the point where having slightly yellow teeth is seen as a personal failing. You drink too much coffee, you smoke too much. It goes on and on and on. But it's just not realistic. Now, of course, children have wonderful white teeth. A child's teeth, which are known as the deciduous teeth, like leaves, they fall out, are generally whiter than adult teeth. They don't have much time to get yellow. But adult teeth, they grow darker due to mineral changes in the enamel. And tooth whitening, or dental bleaching, as it's technically known, has several methods. Usually involves an oxidizing agent applied to the teeth. High concentration bleaching, which is usually done in the office, sometimes at home. It has the gels and the little trays, and the gel generally contains carbamide peroxide or hydrogen peroxide. Sounds freaky, but generally fairly safe. These are usually fairly effective. low concentration bleaching, which is the strips and the toothpaste and all that kind of stuff that you get over the counter, they're usually fairly weak. It could be several weeks before you see any kind of result from them. And a reality of any kind of tooth whitening or dental bleaching is sometimes they're ineffective. They simply will not work. A good dentist, if you ask about it, will often look over your teeth and say, well, okay, this will work, or no, this is not going to happen. Get used to it. Also, interestingly, some treatments actually, they whiten maybe a little bit, but they also do a lot to make your teeth more shiny and reflective, meaning that they look fake. And one of the things that I've heard jokes about, and I kind of observed myself, is that you're spending a lot of money and taking a lot of time to have teeth that look like dentures. And there is a technique that is sometimes used in dental offices, and that's to smear a gel on the teeth and apply light to it. The use of that has been disputed. In the past, some studies have found the light treatment has little to no effect in increasing bleaching effects. Since then, there have been new treatments that may or may not have greater success. Some techniques use UV light. Stupid. It's bad for your skin or eyes unless they're going to put like little goggles and smear you with sunblock. Don't do it. But a reality of bleaching is not all stains, as I said before, not all stains respond to bleaching. Results vary not only with the product used, but with the person that's being used on. A treatment that works really well on you and brightens your teeth almost right away will not work on you. It's weird that way. Dental bleaching also carries risks. The high concentration gels can cause chemical burns on the soft tissues of your mouth if they're not applied correctly. They also will occasionally leave your teeth permanently sensitive. So just biting into something cold or having a hot cup of coffee will be painful. There are also reports, anecdotal, of increased risks of tongue cancer with high concentration gels. Not sure about the science on that. I'm kind of waiting to hear more. But lower concentration home treatments, the people misuse them. I mean, because they're at home, you don't follow the directions. It is important to use things as directed. It tells you to leave it on there for 10 or 15 minutes, and people say, I want my teeth really white, so leave it on for half an hour, and then they end up with burns and sensitive, painful teeth and things like that. I've heard anecdotal stories of people with chalky teeth due to the overuse of bleaching agents, possibly also to overuse of fluoride products, because too much fluoride can make your teeth chalky. So if you do use them, like I said, use them as directed. There's all sorts of horror stories, just any consumer product these days. We were talking at work about the antiseptic cleaning agents that they use, and people using them, using more than what's recommended and using them for longer, and it's wearing away the flooring of the offices because it's so powerful. They say these folks spend millions of dollars researching how to correctly use these products. Use as directed or else. But a big problem with over-the-counter home treatments is that you have to use them for a long time to get any noticeable results. And then you have to keep on using them to maintain the whitening. A 2005 study of in-office whitening treatments found frequent loss of whiteness within a week. And even the most professional and effective whitening, you still have to go back to the dentist regularly to maintain it. But the only way to permanently have perfect white teeth is to have dentures or veneers, and sometimes not even then. Some dentists are known to pressure patients to have their teeth whitened. I had that experience. I had a dentist who was on me constantly to have my teeth whitened. At that point, I just couldn't afford it. And dental treatments, whitening treatments are Not covered on most dental plans. I don't want to say all because I don't know, but to my knowledge, none of the dental plans I know of cover whitening treatments. So they can be expensive. I've seen prices quoted anywhere from $200 to $750. So that's a lot to cough up. And as I said, it doesn't always work. And a reality that many don't realize is that teeth get yellow naturally. It's a natural part of aging. Smoking, coffee, tea, and red wine have something to do with it. But for many people, even if you avoid things like that and you brush and you floss and do everything right, your teeth will still get yellow. There isn't a whole lot of research into this, but from what I found, there is a prevailing opinion in the dental community that the coloration of your teeth is largely genetic. I've been told of one ongoing research project seeking a connection between having red hair and yellow teeth, which, given me and some of my family members, would not be shocking. I just learned to put up with it and embrace it. And most dentists, when encountering a person of mature years who has perfect blinding white teeth, automatically assume you've had lots of work done. It's not regarded as natural. Some very lucky people are able to have dazzling white teeth no matter what. I have one acquaintance who I love and hate at the same time. He has such a beautiful, dazzling white smile. I finally asked him one time what his secret was. He said cigars and coffee. As far as I can tell, he does great. He does good basic care, but other than that, he was just naturally blessed with strong white teeth. And that's just the way it is. And and I went around and asked several friends who have the best smiles. There was this guy who he's just naturally. One friend of mine has another dazzling white smile, and he gets whitening treatments done a couple times a year because he's one of those really A-list, fancy guys. One gal I know has a beautiful smile, and I finally asked her, like, well, what's your secret? And she's like, oh, I had veneers. And then another friend of mine, he said, well, all my teeth fell out years ago. I have dentures. So I was like, geez. I said, yeah, I'm envious of your smile. I said, oh, you want it? Which was like, yeah, okay, no, not like that. And something else I came aware of recently, in Connecticut, they passed a rule stating that any dental tooth whitening treatments had to be done in a dentist's office. Apparently now there are not only salons that are doing whitening treatments, but in some malls and Costco and things like that, they have little kiosks set up where they're doing treatments like that. And of course, the idea was to protect the consumer because you often have no idea when you have it done, like, who are these people? What are their qualifications? What training have they had in this? And when you consider how dicey it can be working with those high concentration gels that can burn your gums and things like that, you'd want to be safe. A libertarian law firm is suing the Connecticut State Dental Board. As far as I can tell, the suit is still pending. But they're claiming that the dental board is creating a monopoly and taking away the public's right to choose and all that kind of stuff. Okay, fine. I can understand where they're coming from. But it's sort of a balance between the ideology of the free market with protecting the public. It seems to me that if you were going to have your teeth whitened, it's generally a smart idea to have it done at the dentist's office so you know who you're dealing with, you know they're qualified, and if something should go wrong, they're there to help you. Personally, I feel if you're having dental treatments at a kiosk in the mall, you deserve what you get.
It's a Darwinian impression.
Yep. So my personal view is you're better off accepting your teeth for the color they are unless the coloration is really awful and it really undermines your self-esteem, or if your profession calls for it. I have friends who are performers and dancers who have their teeth whitened and they just consider it a professional expense. Go for it. It is a valid option for those who want to seek it. It is not without risk, not always effective, and a drain on the wallet. So that's my personal viewpoint. But also, tooth whitening can also erode tooth enamel, especially these at-home treatments that are not always done correctly. It is amusing to see new mouthwashes on the market that claim to rebuild your enamel. It's as if an expensive product was marketed that causes your tooth enamel to erode, so they're marketing a new expensive product to fix the problem caused by the first product. And the promise of rebuilding enamel, I'm sure this is going to happen. Someone's going to assume or hope that, oh, it rebuilds enamel. It's going to heal over my cavities. I can see that happening, and no. How effective are these things? Unfortunately, as far as I can tell, there's not a whole lot of research been done on them yet. But it has been noted that any effect they have on your teeth is likely to be minimal. So we're talking about something that's only swished around in your mouth for about 30 seconds, if that long. And of course, we're the at-home users. We don't always use as directed. Our mouthwash may tell us to swish around your mouth for 30 seconds. We keep it in there for 15 before we spit it out. Your mouth does have a natural mineral rebuilding solution. It's called your saliva. Saliva is very important in restoring and maintaining tooth enamel and protecting your teeth. People who lose their salivary glands, which happens sometimes if you have cancer and you have some radiation therapy on your head and neck, it will kill your salivary glands. And after that happens, you start having cavities and dental problems like crazy. And there's all sorts of treatments for that. But just let your saliva swish around in your mouth, and if you're dry mouthed, chew some sugar-free gum, and that'll help build up the saliva and keep it going around. Occasionally, people have problems with acidic saliva. Your saliva is intended to neutralize acids in your food, but sometimes it can become acidic itself and cause damage to your teeth. Occasionally, this is due to health problems. There's some autoimmune disorder that causes saliva to be acidic. More often than not, it's lifestyle-oriented. Like smoking, drinking soda, eating acidic foods, doing that too much. And if this is the case, then often your dentist will have tell you to cut back on this, that, or the other. And you should probably follow the advice. If a dentist is telling you your saliva is acidic and he wants you to go through these expensive treatments, you might want to get a second opinion. Because more often than not, it's something that can be cured by just watching what you eat and making a few lifestyle changes. Mouthwashes are a good part of dental hygiene. You seldom need more than a basic antibacterial, like Scope, Listerine, that sort of thing. There's a lot of shadiness out there. Used to be one called Plaques. Actually, it's still on the market. It claimed to wash away plaque and leave your teeth feeling smooth and clean. Like that fresh from the dentist feeling, I think they called it. I forget what the ads were like. Well, Plaques contain glycerin. That smooth feeling was the glycerin coating your teeth. So they got nailed for that. They removed the glycerin. It's still out there. That's right. But they don't sell very well. So with over-the-counter stuff, it's best to stick with the basics. Just get a good toothpaste, good toothbrush, a mouthwash, and some floss, and not waste a lot of money on stuff with wild claims unless you have a good, reliable dentist who makes a good recommendation. And moving on to something else, a report that emerged recently caused some concern in the media. A study from Yale University claiming a correlation between dental x-rays and brain cancer. In particular, intracranial meningioma, which is actually the most common brain tumor. It sounds horrifying, but it's actually usually benign. Actually, I think my father has that. He has a benign tumor they just happened to find when they were doing a brain scan for something else. And they actually tracked it for a couple of years, but realized it's not growing or anything. And apparently up at Johns Hopkins, they were saying that, there's probably hundreds of thousands and millions of people walking around with these things in their heads. It never affects them, doesn't affect them at all. There's no reason to ever look for it. So, But now dentists know that x-rays aren't harmless. That's why they try to keep it down to a minimum. But the study from Yale that claimed that x-rays are scary, don't have x-rays, was flawed. I found a great dressing down of this article. Of course, there were lots of scaremongering from various press reports. Well, what was going on? Well, for one thing, the Yale study was flawed. Rather than actually looking at records of dental x-rays, they simply asked people, well, when do you remember getting your x-rays done? Yeah. On the surface, not so bad, but any dentist can tell you that people are terrible at remembering stuff like that. And especially when you're asked to remember when you had x-rays done your whole life. I mean, who can remember that? And some of the people, I mean, the age range was 20 to 79, meaning you had people trying to remember back to the 40s or 50s when they had their dental x-rays done. So the data is problematic right there. Another problem was they found a correlation between the bite wing x-rays, when they take like 1 or 2 x-rays of a couple teeth to see if there's any. They found no correlation between a full mouth radiograph and tumors, which is the full mouth radiograph, boom, 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 which is more exposure. Apparently, less exposure causes the tumor, more exposure doesn't.
Homeopathic.
And then looking at the doses that you get, the X-ray dosage, this is really interesting. A chart from the journal Radiology puts it in perspective. The dosages of radiation in thousands of units, which are called person sieverts, which is like my first time I've heard of it, which apparently is a unit of measure of radiation exposure for a person, as estimated for the entire year of 2005, ranks as follows. Medical X-rays, $8.99. Natural background radiation, $720. Nuclear medicine, $231. Like when you have I had a stress test done, they injected me with radioactive isotopes. I did not develop laser vision. I was very disappointed. Consumer products and miscellaneous sources, 39. Dentistry, 2.5. Nuclear power, 0.1. Simply being alive on Earth means we are constantly bombarded with X-rays. It's happening now. Unless we choose to construct lead-sheathed buildings to live our entire lives in, and good luck paying for that. Or we dig bunkers far underground, and so we can stop worrying about X-rays and start worrying about radon. Some worry about the specific doses, but a dental bite wing X-ray is about 5 microsieverts, and just living on the surface of the Earth is an average daily dose of about 10 microsieverts. As to compare, an airline flight from LA to New York is about 40, a chest X-ray 100, a full body CT scan 10,000, and a coronary angiogram 20,000. So that should put everything in perspective for you. So it seems that in the dental community, if you're already soaking in it, your daily dose of X-ray radiation far exceeds anything used in the office. So a little bit of extra every couple of years isn't going to be a huge risk. And I will talk a little bit about alternative dentists. There's something used by them. They sometimes refer to themselves as biological dentists. Whatever that means, it makes me think they must think regular dentists work on robots.
You don't mean sedation when they put you to sleep.
When you have a root canal, which is when a tooth goes really bad and they have to remove the nerve from the tooth, dentists and endodontists, which is the dental specialty that does this, will commonly fill up the space of the nerve left with a substance called gutta percha, which is a natural latex from a tropical tree. It's been used for over a century, has been proven over and over to be effective and safe. It's biologically inert, as they call it. In the 50s, a new material called Sargenti paste was developed and is sometimes used by these alternative dentists. Sargenti paste contains paraformaldehyde, which, when injected into the root area, turns into formaldehyde and kills off any bacteria in there. The vast majority, and I will give it credit, the vast majority of cases when it's been used, there are no ill effects. However, Even an experienced dentist and endodontist can overfill a root and cause some material to be pushed into the surrounding tissue. It happens. If it's gutta percha, it's natural, it's biologically inert, it just sticks out a little bit, boom, no big deal. Sargenti paste, you get that formaldehyde getting into your tissue. It causes disfiguring problems. If you go to whatstheharm.net, there's a number of stories of people facing severe medical and dental problems that resulted from the use of it, where they've had to have parts of their face taken out almost. Sargenti paste is not illegal. I do believe it is. It's illegal to ship over state lines. I think it is legal to mix up in your own office, apparently. The American Association of Endodontists has labeled it, Sargenti therapy, as unsafe and substandard. It is not taught in American dental schools, but that won't stop some people from using it. So if you're ever going to have a root canal, talk to the endodontist or the dentist about what they're going to use. 99% of the time, they're going to say gutta percha. You know, if they say anything about anything other than gutta percha, put the screws on them and get a second opinion. And I just had to note the irony that, you know, alternative medicine often goes for the traditional and the natural stuff, and they, you know, avoid all these new chemicals and pharmaceuticals and stuff. And here we have the opposite. We have something that is a natural substance being used that is the safe thing, and they're trying to push something new. And how can you tell if your dentist is an alternative dentist? Fortunately, from my research, alternative dentists wear their alternative credentials on their sleeve. They advertise themselves as such. You should always, I think this is basic, you should always check your dentist diploma and certification. Most state dental boards have websites where they list dentists who have faced disciplinary action. But and some states are very aggressive about shutting down questionable dentists. I've had some of the older dentists in our organization talk about how they used to go around armed with badges, seizing people's licenses. Back in the old days, yeah, I mean, gun-toting dentist, boy, woo! It's a little calmer these days. Back in the lawless days of the 50s, you know, these days now they usually have a representative of the board go with someone from the sheriff's office to shut something down if it gets really bad. Yes, sir. Yeah, and that is something that gets really goofy. There's a number of alternative dentists and naturopaths and things like that who have recommended to people, you have mercury toxicity, get your fillings pulled out, they're poisoning you, blah, blah, blah. Apparently there was a study, some kid did a study recently where they showed that actually taking your old metal fillings out actually causes more mercury exposure than just having them.
Yeah, it was actually a science fair, and I was judging, and this kid, his father was a dentist, and so he had like access to medical models. And when you take the fillings out, at that moment, you are exposing the patient to far more mercury than if they're just sitting there for the rest of their life. And he had some way of collecting chemical analysis.
Contact with flesh rather than bones.
It gets in the air they're breathing at that moment.
Yeah. Oh, yeah. And it's real out. It becomes vapor.
And actually, most dentists I know actually prefer having the metal amalgam fillings, as they call them. There has been some theorization that the mercury in the filling actually helps kill bacteria in the teeth that promote tooth decay. But someone else has, actually a friend of mine who's on the Maryland State Dental Board, pointed out, at least according to him, and I haven't been able to look up anything else like that, there have been no long-term studies into the composite fillings that are supposedly safe. So those could be poisoning us even worse than that. And those are actually don't last as long as the metal amalgam fillings. I once had one fall apart on me while I was chewing some gum, and I thought a tooth was coming apart. It was horrifying. The metal amalgam fillings are actually very long lasting. So The amalgams, I don't know. Yeah, and there's all sorts of stories of, there's a story of a man, poor guy who had Lou Gehrig's disease, and this quack naturopath convinced him that he needed to have all his fillings removed. There was mercury toxicity going on. And then they kept telling him the mercury was getting worse no matter what he did. He underwent chelation therapy, which, is to just basically remove all the toxins from him. And he ended up dying. And it was really sad and tragic. And he spent hundreds of thousands of dollars on all these treatments that did absolutely no good. So the mercury toxicity thing. It's very silly. There was one guy who seemed reputable who said a few years ago that they're definitely toxic, but since then they've looked at his research and found it full of flaws. So that's unfortunate. But let's see. And then my final point I want to hit is a growing issue in the dental community is greater integration between dentistry and internal medicine. It is known that various medications can affect your dental health. A common example is tetracycline, which is an antibiotic. If given to a child, their adult teeth can grow and discolored, anywhere from yellow to orange to brown. They don't prescribe tetracycline. Yes?
If it's prescribed to pregnant women, the baby will end up with yellow and brown teeth as well.
They don't prescribe tetracycline for anyone under 8 or for pregnant women.
What is tetracycline prescribed for?
It's an antibiotic. A lot of just the standard things they would give antibiotics for. Sinus infections. Whatever. Something that is a growing issue is the use of bisphosphonates, which are compounds often found in osteoporosis medications like Boniva, and in some cancer treatments as part of the chemo. Now, phosphorus is essential for life. Duh. It's a vital component of your tooth enamel. But like anything, too much can be bad. Back in the 1800s, workers in match factories that used white phosphorus were regularly exposed to high levels of it and would develop what was known as Fosse jaw. That had nothing to do with Bob Fosse now. But it's what medically known today as osteonecrosis of the jaw. Well, what happens is, and this is why I don't have slides. If I showed you slides of cases of osteonecrosis, you would be screaming and running out the door.
Or going, wow, cool.
I don't want to take the chance. But basically, it causes the bone cells of your jaw to die, and apparently your lower jaw is very susceptible to that. If it breaks, it will not knit. If they pull out a tooth, it doesn't heal over. Severe infections, toothaches, swelling of the gums, bones glowing in the dark. Brain damage and loss of the lower jaw. Death from organ failure usually follows. White phosphorus was banned in industry by the Berne Convention of 1906, thank goodness. But it's starting to make a comeback thanks to the use of bisphosphonates in medications. It is rare, thank goodness. The vast majority of those who have taken bisphosphonates do not suffer from any effects. But when it does strike, it's nasty, and the results are reason enough to be cautious when dealing with this. When you have osteonecrosis of the jaw, the hole does not heal over when a tooth is extracted. Implants become impossible. Gum tissue degrades and withdraws from the bone. Lesions develop both inside the mouth and on your face. And if the jaw breaks, the bones never knit or heal. It seems to focus mostly on those who take bisphosphonates intravenously as part of chemo, much less on those who take them orally from, Boniva. It's still little understood. Treatment options are limited and not good, and a lot of research is still being done. And this is something that dentists were noticing for several years. 6 or 7 years ago, they first started noticing this. And only within the past year have they succeeded in bringing this to the attention of the medical community. You may notice now some ads for osteoporosis drugs may now mention dental problems or jaw problems in that long list of potential side effects. I always thought they should just say side effects may include death.
Well, I mean, that's a side effect of birth, isn't it?
Yeah, side effect of birth is. I mean, true. Yeah. I mean, all the diet, all the lettuce in the world isn't going to keep you from dying. There is now a growing call for doctors and dentists to work together whenever bisphosphonates are concerned. I know for our exams we use live patients. For the hygienists do a cleaning, the dentists do a cleaning and do 2 fillings, one amalgam and one composite on a live patient. And we tell them you cannot use someone who's using bisphosphonates or has used bisphosphonates. And the problem is too that there's the concept, which I was not familiar with until I learned about this, of the pharmacological half-life. Some drugs, you take them and there's the half-life. How long they take to get out of your system. Most drugs, aspirin, your decongestants, things like that, the half-life is 12 hours, a day or two. Bisphosphonates, they have one of the longest half-lives of any pharmaceutical. A person my age who takes Boniva for a while, it's going to be in your system for the rest of your life.
If you take one treatment of it, how long until that initial treatment?
I lost the information I had, unfortunately, but it is decades. And it's rather alarming. In fact, actually now they're telling people who are taking Boniva and things like that to actually take it for a while, then stop. There's just no point in continuing taking it after a certain amount of time. But, that is just, it's frightening. And unfortunately, phosphorus is everywhere. I mean, I drank a bottle of soda recently, and I happened to glance at the ingredients, and one of the ingredients was phosphoric acid. And they're still trying to figure out, how much, is it just bisphosphonates? Is it other forms of phosphorus? How much?
And your body will also naturally produce phosphorus.
Yes. Yep. So they're still trying to figure that out. And I mean, I stood in the dental aisle of my supermarket trying to find a toothpaste that did not contain phosphates of any sort. And it's hard. So, I mean, they're still trying to figure out how to, which forms of phosphorus are the bad ones, how much is too much. So until that, I personally am careful, but I'm sure I don't need to be. It's probably being overly cautious. But that is just one of the ways in which there needs to be greater integration between the two disciplines. I mean, it's already commonly known an abscessed tooth can transmit infections to the heart or brain. A young boy in the D.C. area died a few years ago from an untreated abscessed tooth. And I've read some stuff from archaeology when they've examined mummies in Egypt and even a skeleton that was found in Annapolis, which they figured out was an indentured servant from colonial times. And apparently they were able to figure out that he died from an abscessed tooth. There's a growing opinion that oral health can influence your overall health. There's a recent study of Bristol University that proposed that Streptococcus, a bacteria responsible for tooth decay, can also cause clots when introduced to the bloodstream and could be responsible for heart attacks. But then there's a feeling, too, that gum disease is an invitation to other health problems. I mean, bleeding gums are a gateway for bacteria to enter your bloodstream. And human mouths are dirty. They are dirty. I mean, that's why human bites are really cause for concern when you go in for emergency treatment after a fight. Not like I've had experience with that, but I know I had a tooth that was one problem after another for years, and I finally had the thing extracted a few years ago because it was just really badly off and there was no fixing it. And I really felt like my health improved quite a bit after that. Of course, I'm not sure how much of that was just removal of bacteria and infection or just relief at getting the damn thing out once and for all. So, but, a good dentist will try to get a good idea of your health. They take your blood pressure most of the time. They'll ask you how you're feeling. A good dentist will have some basic medical knowledge. He may not be able to, diagnose something, but he might be able to spot something and say, you should see your doctor about this, that, or the other. But there's still, but in the perfect world, your doctor and your dentist will be partners in making sure that you're getting good care. this is not a perfect world, unfortunately. But there's still a lot of research being done, lots of new stuff on the horizon. Implant technology is becoming cheaper, and there's talk of teeth being grown from stem cells. There's talk of endodontology just kind of falling by the wayside. If a tooth goes bad, they're just going to take it out, implant a new one grown from your stem cells.
Would it take root?
They have it's like screwed in. It actually looks like a tiny little Dalek in your mouth. I've had that done. But I mean, just to close, I have to wrap up, unfortunately. Taking care of your teeth isn't just about looks. It really should be thought of as part of taking care of your overall health. Don't sacrifice your health for looks. Thank you very much.